Hello and welcome to the Valley. Today, I am your host, Janet Michael. It is Community Health Day. That is the day every month sponsored by Valley Health where we jump on a Zooms and we talk with a physician about a health issue. We talk with an administrator about a new program. We've talked about our mental health. We've talked to cardiologists. We've talked to neurologists, pulmonologists, all of the things over the last several years that I've been doing this show with Valley Health. As a matter of fact, just this past Friday, I was on the Zooms with Dr. Fight getting some insight into the flu vaccine. Today, we're going to talk, though, about primary care. So Dr. Kevin Volkema is joining us. He is a board-certified primary care physician specializing in family medicine. He's located at Valley Health Primary Care Greenwood. So Dr. Volkema, thank you so much for taking the time to meet up with me on the Zooms today and tell me about your practice.
Janet, thank you so much for having me, and thank you as well for the introduction. Before we dive in, I can share just a little backstory about myself and why I went into medicine. Some of your listeners might be able to quickly tell that I have that nasally northerner accent, and so I grew up about an hour outside of Chicago in a suburb called Wheaton. I was born, raised there, everything there, and medicine first came on my radar probably around high school time. It was in a very short amount of time that both my own primary care physician and actually my chemistry teacher both pulled me aside and said, you might want to consider medicine as a field. And at that point, I was 16, 17 years old. I didn't really think too much of it, but clearly I took that seed, took that idea and stored it away for later. I did my undergrad at the University of Illinois in Champaign-Urbana, which is basically the state of Illinois' big state school. And when I was there, going into my sophomore year, I still really wasn't sure what I wanted to do with my life or what I wanted to study, but medicine was starting to inch forward. And so I said, you know what? Let's get my EMT license. Let's volunteer at this clinic for the uninsured in town. And let's really kind of take a leap of faith into healthcare and see, is this a path I want to go down? And I really, really enjoyed that year. I enjoyed the classes, but most importantly, I enjoyed working at that clinic for the uninsured. And that's really, I think, where the foundation grew of this appreciation for community health and community service and really this grassroots effort of making change for individuals. Then did med school in the Chicago suburbs at a medical school called Midwestern. And there I really entered medical school knowing that I wanted to go into primary care. And then I did my residency at Northwestern University downtown. And that's where I met my wife, who's a Winchester native. She's a physician as well. She's in the NICU here at Valley Health. And then we took a quick pit stop in Charlottesville, Virginia, because my wife did her neonatology fellowship down there. She was at UVA, I was at Centera. And that's also around the time where my career kind of took a little bit of a turn and I also jumped into the world of administration, which I do as well here. So about half the time I practice and half the time I'm a regional medical director. So I did that at Centera, and then I also do that here for Valley Health as well. And we actually are still newer to the area. We moved here this summer around July. So we're still getting, well, for my wife, reacclimated, but for me, acclimated to the area.
I love that your wife is a physician in the NICU unit. My mother-in-law retired from Valley Health as a nurse in the NICU unit. So
Oh,
we're
wow.
connected already.
Oh, absolutely. Just to even contrast primary care to the NICU, many people, when they think of healthcare, they think of a TV show and an emergency room, an operating room, an ICU. They think of this hypercritical, really serious acute moment. And the reality is that's not the majority of health or the majority of healthcare. And there's a lot of different analogies that people use to describe primary care, right? People call primary care the quarterback of your health or the one-stop shop or the front door, the home base. People use words like general practitioner or primary care, family medicine, all different terms. But really what it's describing is that point of contact, typically the first point of contact, but also ideally the most frequent point of contact, at least in a well-functioning health system, that adults and children can go to for prevention, for diagnosis, for screening, for chronic disease management. It's really that kind of hub. And it's really a location and a practice that's focused on long-term relationships and that continuity of care so that you can basically recognize medical problems ideally before they actually develop and before they happen. Unfortunately, we all know in reality, it doesn't always work out that way. And so that's why a large percentage of our day, we're focusing on managing chronic medical problems and trying to mitigate them from becoming more serious as well.
I think
Mhm.
when I was growing up, having a primary care physician was just the norm. Everybody had one. It's how your medical care worked. And then with the advent of your urgent cares and your urgent care expresses, I think people tended to get away from having that one point of contact. And it
Mhm.
does make it more complicated if that's the only place that you're going to have someone to be able to say, oh, wait, but now you've done this and this and this, there's a pattern here that we need to look at and maybe can make some changes so that you don't have to constantly be seeing someone in an urgent situation. Coming back to having a primary care physician, I think is great that it's now the trend, I hope.
Yeah, in urgent care, they provide a great service. And just to give credence to why people feel like they have to go there is I had a mentor. He told me when I was in medical school, he said, Kevin, he said, there's three things that people care about when they see a PCP. They want to make sure you're able, they want to make sure you're affable, and they want to make sure you're available. And if you fail on any of those three, you're not going to be successful. And I think for the most part, I think a lot of people end up going to urgent care for that last one, availability. And it's become a huge, huge challenge throughout the United States. There was actually a big study by JAMA, which is basically like the big journal of medicine that a lot of physicians will refer to. What they found was that just one primary care physician for 10,000 people, so just one for 10,000, has measurable effects on decreased mortality, decreased hospitalization rates, decreased emergency room visits, and decreased costs for that individual and for the surrounding system as well. And then, of course, improved chronic disease management. So one person could affect 10,000 lives, at least that's measurable. That's a pretty huge impact. And I think Valley Health has recognized this and has made an incredible investment in primary care. I think people who maybe are not as new to the area like myself have been able to see that pretty quickly, not only with building the clinic that I work in, but also all the other clinics in town as well. Building Jubal early, building and remodeling existing facilities really elevates not only access, but also the care experience as well.
It really is one of the most personal professional relationships you're going to have with someone. And knowing that I can make an appointment and I can come in and say, hey, I've got this going on. And you have that history. You
Mhm,
have seen me through other issues, or you've seen my children through other
mhm.
issues, really does make it easier as well for you to be able to make a diagnosis or to give me treatment for something that you may have to go through a couple other steps if you don't have that PCP right there to be able to look at your history and understand your background.
Oh, absolutely. Continuity is king, and it's so incredibly important. And you actually touch base on one of my favorite parts of the job is I really enjoy seeing an entire family. It's so much fun to see both parents, the grandparents, the kids, because you really get to understand them. Right. I regularly begin my appointments, and one of the earlier things I ask is about lifestyle. I like to dive into that right away because who you live with, how you sleep, if you're stressed, if you are eating a healthy diet, if you exercise, those are going to influence everything. But if I don't even understand the basics about who you are as a person or how your life works, how am I supposed to help you with your chronic medical conditions? And I don't have to see the whole family to build a relationship, but over time, that continuity trust will develop, not only with time, but also as we start to dive into some of these challenges. And something that I think a lot of individuals might not realize is that primary care is actually the largest healthcare provider of mental health in the United States. The majority of people, when they have depression or anxiety or a loved one passed away, they come here first because we are that entry point for them, but also because they trust us. We've built that relationship. We've put in the effort to develop that connection with them so that when things do arise, they feel comfortable talking with us. The one other thing too is working with that chronic disease. I really think of chronic disease kind of having four pillars, and some people call it the four horsemen, I guess, of chronic disease, right? And that's cardiovascular disease, metabolic disease, neurodegenerative diseases, and cancer. And a lot of that continuity, a big focus is focusing on trying to prevent those four from developing, or at least trying to push it off into later in the timeline so that instead of being diagnosed maybe with a chronic medical condition at 55, maybe you could push that back to 65 or 75 through just lifestyle tweaks, through just being mindful of maybe how some of our habits that don't seem that bad in the moment can actually really cause serious problems later on.
And that is true of so many things. If I could go back in time and take better care of my skin
Mhm.
and my diet when I was in my 20s, I am sure that I would be in a much better position now that I am in my 50s. That holds true for all of us. And it's never too late to make that step.
Absolutely. That's the biggest thing I always try to tell people is yes, the potential maximum benefit might be different if someone's 18 versus 98. However, it's never too late to make a change. There's actually a lot of really impressive data on individuals 65 and up starting exercise routines, starting weightlifting routines, and measuring sizable changes in their bone density and their muscle mass and how it affects their metabolic health, their function. And so, absolutely, I regularly tell my patients of all ages there's never a time that's too late to start. It can always make a difference.
We have to go to break here in a second, but you just mentioned something that I think is also worth expanding on a little bit is that I think that PCPs, primary care physicians, get a bad rap sometimes because people think they can't be that specialized. They don't understand the breadth of your education and all of the research that you stay up to date on and all of these other things. So they think that you're not going to be able to help them with a specific situation when you are probably even more qualified to do so because you've been seeing them for all these other things over the years.
Yeah, you do bring up a good point. I'm not a specialist, and my other primary care colleagues were not specialists. And so we have a lot of breadths. We know a fair amount about a lot of things. But of course, all those topics, we all don't know equal amounts of every topic. That's impossible. Some primary care physicians, they might be a little more knowledgeable about metabolic health. Someone else might be a little more knowledgeable about cardiovascular health, just based off interests or what their patients need. And so, of course, there's going to be some variability as opposed to one specialty, one hyper focus. But there's two areas that we have a huge, huge advantage. And you actually hit the nail on the head with one of them, and that's that connection. Because you can know everything you want in the world about that one subject for that one body part that you're having a problem with. But that specialist isn't going to have the benefit of having known you for 3, 4, 5, 10, 15 years and knowing who you are as an individual and knowing those situational things as well. But the other piece is that when I see individuals who previously have never seen a primary care physician, but they've been only following with specialists, there are always gaps in their care. And some of them are pretty impressive and pretty scary gaps in their care. It could be cancer screenings. It could be unknown medication interactions. It could be a total lack of assessment of certain very common medical conditions as well. And so the other thing that primary care can help provide a benefit for is shoring up those gaps, because really it brings it back to the first thing that we talked about. One of those common analogies that people use is the quarterback or the captain of the care. It's keeping an eye on all these different facets of an individual's life and an individual's care to make sure that there's not only a hyperfixation on one type of problem or one concern, and that all the other factors are still being addressed as well. And so I think that's where we can really supplement and help out, because an individual, they should always have a primary care physician and really always focus on prevention and management of chronic disease. And then when needed, of course, go see that specialist.
Let's take a break. When we come back, let's talk a little bit about your particular practice, where you're located. Are you taking new patients? What types of services do you offer? Can we get in the weeds on that in the next segment?
Absolutely.
We are on the Zooms today talking with Dr. Kevin Volkema. He is a board certified primary care physician specializing in family medicine at Valley Health Primary Care Greenwood. We're going to learn more about his practice when we come back in just a couple of minutes.
This Saturday, Henry Mueller will change the world. He has no idea that's what he's going to do. He only knows that he went to justserve.org and signed up to spend time at a senior center Saturday morning. As he browsed through service opportunities in his own community, he remembered the words of Paul to the Galatians, "By love, serve one another." Little does Henry know that Saturday morning he'll end up speaking to one senior in particular who hasn't seen his family in several weeks and is feeling especially lonely. Henry doesn't know the short time he'll spend with this man will lift his spirits, cheer his heart, and make his life just a little better. Through love and service this Saturday, Henry Mueller will change the world. See the difference you can make. Sign up for service opportunities in your community. Visit justserve.org.
Welcome back to the Valley. Today, I am your host, Janet Michael. It is Community Health Day, sponsored every month by Valley Health. Today, we are talking about primary care. Dr. Kevin Volkema is joining us. He is a board-certified primary care physician specializing in family medicine. And Dr. Volkema, your practice is located, you're with Valley Health Primary Care Greenwood, which I have to tell you, you told us earlier that you're fairly new to the area. I'm born and raised here. It is amazing to me how that particular area of Winchester has exploded. It used to be nothing but farmland when I was growing up and going to high school. And now there are grocery stores and all sorts of things around where your practice is.
Yeah. So we're at the corner of Sensony Road and Greenwood. It's a little hard to see from the corner. And so if you know where the McDonald's is, we're just about 50 yards closer to DC than the McDonald's. Same side of the street, same everything. And yeah, I think Valley Health really recognized that not only our entire county is growing, but also that part of town is growing as well. And really from there to Berryville, we've just seen an incredible amount of growth in the community. And so really that clinic is a response not only to existing needs, but also the anticipated ones with all of the population growth that we're seeing.
How many PCPs do you have in your practice? Are you accepting new patients?
As of today, we have 5 PCPs. 3 of us are physicians. Then we have 1 physician's assistant and 1 nurse practitioner. And then we have another 3 physicians who have signed and will be starting with us in 2026. 1 will be starting in May, and then 2 others will be starting in July. And then after July, we'll probably pause for the time being just to recalibrate and make sure that we're meeting the needs of the community in that area. For your second question of accepting patients, absolutely. We are all accepting patients. And so if anyone is looking for a primary care physician, there's 2 ways that you could research us. Both are on Valley Health's website, valleyhealthlink.com. You could do after.com/primary care to learn about primary care in all of Valley Health, or you could do /find a doctor. If you want to find a specific individual or search by a location or a specialty, both of those would be options for you as well.
There's such a misconception, I think, out there that you can't get an appointment, that nobody's taking new patients. We hear that so often, and there is availability out there with PCPs in our area. You just have to know where to look.
And I also, too, just to further reiterate, Valley Health is committed to continuing to build and recruit physicians to serve our area. And in the coming years, I think the community will continue to see that there is more and more access. It is a battle, right? Because I think most communities are trying to work hard to find more access and more primary care physicians. But thus far, Valley Health has done a really impressive job the last few years with that. Some things to keep in mind is I've had quite a few patients not only find us through Google search or websites or through their insurance, but I do know that there's some online communities. There's one called Nextdoor and Facebook and other ones where people have looked and found us that way as well. What's really interesting is the majority of our patients thus far seem to be people that live in this area of town because it's just so convenient for them from a location perspective. The other thing too that might be beneficial for listeners to know who don't live nearby and are happy with their current PCP is our building does have a full lab service there as well. That's open from 7 a.m. to 5 p.m. Monday through Friday. And so if you have a Valley Health physician who's ordered labs for you, you can walk into our lab that's in our building, get your blood drawn, and your Valley Health physician will get those results. And so that's really beneficial because I know many individuals don't want to necessarily go on the hospital campus or to some of the other locations, depending on what works best for them in their schedule.
So many of us live in a different area than we work, or vice versa. And so convenience is a huge thing that if they work on Berryville Avenue, but they live in Middletown or Stevens City, you're much more convenient to go get that lab done. And then they can just pop over to work. So I think that's fantastic that you have those options.
Yeah, our patients have been incredibly thankful for it so far because it's offered a lot of flexibility and convenience. And we're still kind of in that sweet spot where I don't think word has really gotten out yet. So people are very much in and out, which is always a nice treat for them.
The other thing that I want to make sure that we touch on when we talk about a primary care physician, I think sometimes people think, oh, yeah, but I have to have gone to them for my whole life in order to start going to them. When we were talking earlier about at any point, it's a good step to take that first step. We're knee deep in the middle of flu season. RSV is everywhere. COVID is still a thing. People can come to you as that reason for being their entryway into having you be their PCP. That's okay too.
It absolutely is. The one expectation I do want to set is that our location is not an urgent care. And so if you walk in, never been seen, the front desk is going to say, okay, we'll need to schedule you for an appointment. And you might get lucky. We might have same day access that day, but they also might tell you that you need to return on a different day. And so I just want listeners to know we do have same day access, but it's an appointment for same day. And so usually our access has been pretty good. All of us hold multiple same day slots to accommodate our existing patients and new patients as well. And then we have a physician's assistant, and all she does is see same day patients as well, people with those same day needs. And so that helps provide an additional surplus for existing Valley Health patients at our clinic and other clinics, but also those individuals in the community without PCPs. And that has been a really, really helpful entry point for some of our patients as well, who have come in, they've had a sick visit, or they need refills on their medicines, whatever it may be, and they'll get in that way as well. I do just want to have one plug for a Valley Health clinic that isn't where I work at, and that's the transition clinic that's on Amherst, closer to the hospital. If you have a lot of complex medical needs and you need a PCP, you just moved to the area, you had a serious hospitalization, and you need a doctor and you're being told it's going to be 2 months, it's going to be 3 months, that's a really long time if you just had a major medical event. And so I just want our listeners to know that would be the clinic that would provide that transition, that bridge for care if you have more complex medical needs and you need to be seen right away and you want to have a more stable, more contiguous transition to your ultimate PCP. I end up seeing a lot of patients that way as well.
And when we're talking about just your, I don't want to say run of the mill, because when somebody has RSV, COVID, the flu, a cold, any of those things, when it's happening to you, it's much worse than what it may be to somebody who's watching it happen to you. But having access to someone like you who knows, again, can either start that history when I come in or has that history to say, you typically get a sinus infection about this time of the year. Maybe it's not A, B, or C. Let's look at what this is. Again, it's both of those things that come together to make having a primary care physician really beneficial.
Yeah, absolutely. That continuity really, really helps. Some individuals knowing their history and knowing that they might live in an older home or they might live in a home with mold exposure, knowing you also have lung disease. And maybe we want to treat this like a COPD or asthma exacerbation, given your chronic condition, as opposed to just saying, here's antibiotics or here's other treatments and just saying, hey, common things are common. It's flu season. Here you go. See you later. Not saying that urgent cares always do that, but sometimes that can be people's perception. And sometimes having your primary care physician can really give you that focused, individualized care to your specific situation. But yeah, we do offer same day testing. So individuals that are worried that they might have strep or flu or COVID, they can come in and they can have a swab done and they'll, in like 15, 20 minutes, get the answer, get the response to see, yes, do I have strep throat or do I have influenza or do I have COVID? And that's been really beneficial for our patients too, especially as multiple different viruses and bacteria are going around through our community.
I think so often many of us wait until we're in the depths of whatever thing it is that we have, where if we start with a cough or we start with a sore throat or we have a headache, some of those things, and we can call you and say, hey, this is what I've got. And I have a coworker who's out with the flu, or I have a coworker who had COVID a week ago. The earlier that you make those steps to get in to see someone, a lot of times the less bad you'll feel for a less amount of time.
Absolutely. When you talked with Dr. Fight a few days ago, I don't know if you guys went into this or not, but when you think of treatment for things like influenza, for example, which is a classic example, Tamiflu is most effective if started early and ideally early as possible after exposure or symptom onset. When people were doing more of the antiviral COVID treatments, right, like Paxlovid, which was commonly prescribed, same thing. You wanted to start that early on in the disease course because it was so much more effective for individuals when they started sooner. So absolutely, it's always better to come on in on the sooner end as opposed to wait until you're absolutely miserable.
So where can people go? Someone's listening today and they had no idea that there were primary care physicians in our area that are accepting new patients. Where should people go? Where's the best first place for them to start?
Assuming that things are well, you're not in a crisis, things are okay, I would say start off and go to valleyhealthlink.com, and then you could do /primary care or /find a doctor. And that would be your way to look on our website, look at locations, look at individual physicians and advanced practice providers, and see, is there a primary care physician or provider that I would want to follow with? So I think that would be a great first step. If you are sick, though, that would be the time where you would want to try to find either a same day or urgent care appointment. And so you would want to obviously be seen much, much sooner as opposed to a couple months out. And then lastly, if you are an individual who recently moved to the area, has complex medical needs, there is that transition clinic as well, which would be another avenue to get in with Valley Health Primary Care. And they would then eventually support you in that transition to an eventual primary care, potentially like myself or someone else on our team.
And I want to point out that if you are in the throes of something right now and you do go to urgent care, that doesn't mean that they can't still reach out to you for that follow-up. They can't still say, okay, I took care of this in the moment, but I'm going to now call and make an appointment with Dr. Volkema, with somebody else at Valley Health Primary Care Greenwood, just for the follow-up and to make sure that I am truly on the road to recovery.
Absolutely. Our Valley Health urgent care colleagues, they're phenomenal. They really take pride in trying to make sure that individuals without a primary care physician do get that follow-up, or at the very least have those resources so that they can make that appointment. And so they're going to be looking out for you as well, especially if you articulate and you make it known that you need a new PCP or you're going to be seeing one. They can, of course, point you in the right direction too.
Dr. Volkema, thank you for taking the time today to introduce yourself and to give me some insight into the value of primary care physicians. I appreciate your time today.
Of course, Janet. Thank you so much for having me, and I hope you have a good rest of your day.
I will be back tomorrow with a brand new episode of The Valley. Today, we're going to introduce you to Cynthia Fairbanks. She is the newest extension agent representing Warren County. So meet me back here for that just a few minutes after noon.